like a 24-year-old male who's had tree fall in his leg, causing a tib-fib fracture.
I took ETA into the area about 20 minutes.
Received, thank you.
On a sub-zero night in Melbourne, an air ambulance team is about to head to the Dandenong Ranges, 70 kilometres east of the city.
HEMS 1, is the crew at that location yet?
Negative.
A tree has fallen on an emergency services volunteer, badly breaking his leg.
HEMS 1, we're just coming over the back of the Dandenongs now. Can they put their beacons on, please?
A local ambulance crew is already on the scene. Given the severity of his injuries, driving the patient out on rough, unmade roads is not an option.
Isolated injury, got very left lower tib fib and upper left ankle.
But getting a chopper to land in this heavily treed area late at night will be a logistical challenge.
It's not your average job. It's up in the hills. It's dark and cold, and you certainly know right about then, at night time, on night vision goggles, coming in a confined area. It's the most vulnerable point you'll ever be probably in this job.
Are you visual yet?
Not yet. Oh, yes, sorry. You reckon that's it?
Yeah, I do reckon that's it.
The landing site's now been identified, but the tension is increasing with so many obstacles below.
Both doors are going back, stand by for caution.
It's now all hands on deck. All of us are crew working together basically to get this machine safely on the ground.
So there's a road around the outside of it. Looks like it's just sort of grassy in the middle. No worries, mate.
Your senses are heightened. If you miss something, accidents will happen. If they happen there, they're probably catastrophic.
Just maintain height to it there on the left and right, still with 80 to run. We're going to end up in a 20-foot hover above the pad as you move forward 40, please.
The crewman who's doing most of the work is guiding the pilot into an area, and he's identifying hazards and risks.
Forward 3, 2, 1, hold. Drive well clear of all obstacles on the left. I've just got a sapling here on the right.
Everything and anything, including power lines that may pop up, and he's guiding the pilot down basically with his voice.
It does look good forward on the left, it looks good rear to the left. Nearest trees on the left-hand side are at the 9 o'clock. Drive well clear of obstacles on the right. Drive clear down left and right.
We're trying to look for anything that can endanger, that can come up on us, understanding that we're on night vision goggles, we can't see everything.
Got a sapling under us, that's all right. Nose approaching. Yeah, we're all good. Ray, thanks, buddy. That was really good.
With the chopper successfully landed, Ray can finally get to his patient, 24-year-old Andre.
Andre, my name's Ray.
How are you, Ray?
We're trying to figure out what you guys were doing out here, but someone's been dropping trees across the road, haven't they?
Yeah. Well, they cut the tree in half, and then they must have just left it, and they've just fallen.
Yep.
So we cut the first tree, cleared that one off the road, then we moved to the second tree, and then got 3/4 way through the tree, and then the accident happened.
Apparently this tree flips. It's changed something about the centre of gravity and it's flipped over, and it's bit him in the leg, and it's bit him good. So it's broken his leg straight through.
Pain-wise, good?
Yeah, it's good for
Leg feels okay? Yeah. We just want to keep you comfortable.
It's been over 3 hours since the tree fell on Andre's leg. But before he can be moved to the chopper, Ray needs to check the Good Samaritan for any internal injuries.
Just going to scan your tummy. Yeah. I know it's nowhere near your tummy, but you had enough trauma running in. We'll just have a quick look.
So we do an ultrasound on Andre to rule out abdominal injuries and pelvic injuries and chest injuries. So we want to make sure there's no bleeding in his abdomen and his pelvis is intact. Perfect.
Ray's happy with the ultrasound results, but Andre still has a pressing problem.
And you need to go to the toilet. Right?
Yep.
We'll get out of here as quick as we can. All right, let's get you up and out.
A couple of small bumps there, Andre.
Me? Yeah, mate. You with me? Yep. I already see this isn't going to tickle. We'll gently try to roll you.
Ready, set, go.
Bit bumpy here, Andre, okay? We'll try to mitigate it as much as we can.
Yeah, what can you say about volunteers that have come out from a day of work and have gone out into the very back country to clean up trees that looks like someone popped across the road? They're not getting paid for it. The community will never know they've done it. It's beyond astounding to me.
It's a 15-minute flight to the Alfred Hospital. On the helipad, a medical team is waiting to take Andre straight to emergency to find out the extent of his injuries.
Hey, I'm Sian, I'm one of the nurses. How are you going? Yeah, good. What have you done to yourself?
I dropped the tray on myself.
We'll get you off, we'll get you inside, down into one of the trauma rooms and get a doctor to have a look at you.
The worry for Andre is just how long it will be before he can go back to his day job as a truck driver.
Okay, mate? Yep.
Ray knows this volunteer who has made so many sacrifices for the community is now facing tough times ahead.
Andre's a ripping bloke. Yeah, I can't do enough emergency services because we know what they go through.
How's your pain going?
Yeah, it's all right.
All right, we'll get you inside and we'll go from there.
At his home in Melbourne's outer east, 24-year-old Andre is slowly getting back on his feet.
We'll be able to go for walks again soon, mate. No stress.
3 months ago, the emergency services volunteer was airlifted to hospital after a tree fell on his leg while he was helping clear roads late at night.
Pretty amazing how your life can go from being completely normal to, not being able to do anything at all for this long.
Andre's leg was broken in 4 places, and he's still waiting for the medical all clear to go back to his job as a truckie.
It's Andre from Pakenham State Emergency Service here.
But despite the ordeal, Andre continues to help out the community, manning the phone.
I was just blocking one lane. Been trying to do as much as I can, even though I'm not allowed to physically go out and do any jobs. I just want to help people, I guess. They say what goes around comes around, so, if you help others, and hopefully they'll help you when you need help.
Emergency services. Tell me exactly what's happened. Robin has had a fall. Yeah. He was screaming with pain. He said, I'm having a heart attack.
In the city centre, paramedics Nat and Leonard are rushing to the aid of a man with severe chest pains. This could be another case of life and death.
Man, this traffic is out of control.
Isn't it?
It's horrible.
But it's peak hour in the city centre.
Yeah, you clear all lanes.
What?
No, not clear now. She's decided to move. Stay there.
Kidding me?
Far out.
You need to stop.
Stop, mate.
Stop.
We have to be very careful driving in the city at night. People do very unpredictable things.
Is it down the lane?
It's down here, supposedly.
I don't think anything surprises me anymore. People stop right in front of us. People pull out in front of us. It's very dangerous.
No, that's not
Number 10. Here we go.
Sheesh.
Okay.
Hello, you're the patient, sir?
I'm the patient.
You're the patient.
75-year-old Robin has been waiting for paramedics with his neighbour and friend Jay.
When we arrived, Robin's very concerned about this pain he's been experiencing in his chest.
It's got worse.
What's got worse?
The pain.
As a heart attack is suspected, Robin must be assessed quickly.
Tell me about what's happened today or what's been happening
I had a
recently
couple
with
of
you.
collapses when I came out of the bathroom.
What did you hit first? Which part of your body?
This side down here.
Yep. You landed kind of on that left side.
Correct.
And you've had pain there ever since?
Yes.
Despite 2 major falls, Robin's convinced it's his heart that's in trouble.
Robin called me. Every time he breathed, he was in pain. And he said, Jay, I think I'm dying.
I couldn't move. Every time I moved, there was this staggering pain going through here, which is where I think the heart is.
Very early on, I noticed how stressed Robin is. You can just see it on his face. He's certain that he's going to die.
Robin's complaining of severe pain, but through our assessment, we don't find anything seriously wrong with him. He looks remarkably well for someone complaining of chest pain.
With a major heart attack unlikely, the team now has the task of figuring out what's really going on.
I was lying on my bed. I was scared.
Because the pain was so bad.
Yeah.
Yeah. I just want to butt in, if you don't mind.
No, go for it.
What you're describing at the moment and what we can see on the monitor and the way you present at the moment, it's unlikely that this pain is coming from your heart. Rest assured,
that's good.
because I get the feeling that that's what you're concerned about.
Yes.
It's highly unlikely that what's happening is caused by heart or cardiac chest pain.
Thank God.
Okay, so I think that seems to be your main concern at the moment. Okay.
Yeah.
Robin's anxiety could be contributing to his symptoms.
Many patients that we go to are fearful that they're about to die or that some really bad medical event is happening to them. And often all they need is reassurance.
You've never had any diagnosed heart issues?
No.
No, so definitely no heart attacks?
My father died of a heart attack.
How old was he when he passed away from a heart attack?
61.
61.
Robin reveals to us that his father actually passed away from a heart attack, and it becomes clear that he is petrified. Robin really thinks that today could be his last day.
I think why I get so scared when something like this happens. It's difficult.
It's all right.
I might die.
It's all right, Robin.
For a grown man to start to cry and become very emotional about his potential death, it just goes to show how stressed and how confident he is that something terribly wrong is happening to him at the moment.
Does pain progress after you fall over onto the floor and then suddenly turns into some hideous knife blow?
It could. I'm almost certain that this pain is going to be related to you falling over. It's
That's a relief.
I think what we do is we get an absolute certain diagnosis from the hospital.
Yeah.
We don't think it's your heart. We think it's probably an injury, but let's be 100% sure.
With Robin's mind now at rest, the crew sets about managing his pain.
Bit of a sting.
Move. I was a designer of clothing for
Were you?
endless years, so I was always choosing the model, of course. Have you ever tried to do it?
Try to do what?
Modelling.
No.
But you've got terrific bone structure.
Oh my goodness. Do I?
Yeah.
Thank you. High cheekbones?
Yeah.
Thank you. Robin's so much calmer now, feeling so much better, that he actually notices my high cheekbones. You hear that, Leo?
I'm listening and I know you're excited.
I'm just thinking, surely he's taken her height into consideration. If we see Nat walking down a catwalk, she's going to have to be wearing very high stilettos. You know, models have to be tall.
Let's get you out and get you checked out.
Nat and Leonard are now on their way to hospital with 75-year-old Robin.
You know, obviously, all of this made you quite emotional. Was it purely because your father was passed away at 61, or was it?
He was young. My mother died at 54.
From heart disease?
Heart disease.
Okay, so there's a strong family history for it. Okay.
After 2 falls, Robin's anxieties about death may have aggravated his symptoms.
I thought I was dying.
Yeah, look, I know, Robin, that you've got so many family members who've obviously had such a shocking run with heart disease, but I don't want you to feel like it's going to be your destiny because your family have also suffered through that. Oh, yeah.
That when you're on your own, particularly, that I was getting worse and worse into it, that I was going to die.
I had a lot of empathy for Robin. He wasn't just fabricating this idea in his mind that he was going to die. He's seen it happen before to his family. So it's understandable to get worked up because now he's got chest pain, and the last time his family member had chest pain, they passed away. So I totally empathise with him.
Okay. All good?
All good.
Excellent.
It's a nice feeling to be able to tell a patient that, you know, they're not having a massive heart attack. Sometimes, you know, that's all you can do for them, and it gives you such joy and pride to be able to give them that relief and that happiness. Yeah, I'm a big softie.
I liked Robin.
All he needed was to be told you're not having a heart attack.
Yeah.
And his mood just changed like that.
Yeah. And he was looking at me the whole time, so...
Did you ever think that you had good cheekbones? was when he saw you.
Yeah,
you know?
yeah. I'm just trying to see what's my. Yeah.
You're going to be looking at yourself in the mirror non-stop. Oh, hello.
Okay. You want to turn around? Sure.
Oh, she's got pretty high cheekbones as well.
She
You're gonna have to let her go.
does.
She does.
She's got great cheekbones.
She's got great cheekbones and she's driving a Mercedes AMG.
Yeah. Oh, and she gave me a wave. She's looking at my cheekbones.
She's like, you and me the same.
I know. We're twins. Yeah.
As for 75-year-old Robin, who feared he was suffering a heart attack after a fall, X-rays revealed the cause of his chest pain was in fact 2 broken ribs. Robin was released from hospital the following morning and has made a full recovery.